Good morning. Today we are going to discuss about the benign lesions of jaw bones, that is especially cysts and tumors of the jaws. The other benign lesions, that is fibrosis lesions of the jaw bones, we have discussed in the other session, that is benign soft tissue lesions only. We have discussed about the oral tissues only. We have discussed about the soft tissue benign lesions and also the fibrosis lesions of the jaw bones. You can go through that episode, that is benign lesions of the oral cavity. You can go through that. So here we are discussing only about the cysts and tumors of the jaws. The first question is, most commonly occurring odontogenic tumors are. So what is the most commonly occurring odontogenic tumor? Is it calcifying epithelial odontogenic tumor, ameloblastoma, benign cementoblastoma, or odontoma? Which is the most common? There is no specification about the type of tumor. Only it is mentioned that it is odontogenic tumor. Among odontogenic tumors, which is the most common type? The correct answer is odontoma. These odontomas are the most common odontogenic tumors. Next question is, cystic fluid, if it is aspirated, it contains like cheese-like or a viscous thick fluid. In case of which lesion, you will see this cystic fluid as a thick viscous fluid and cheese-like. Is it in follicular cyst, desmoplastic ameloblastoma, or the keratocystic odontogenic tumor, or residual cyst? In which case, you will see this cheese-like or viscous fluid when it is aspirated. The correct answer is keratocystic odontogenic tumor. In this, you will see that keratin deposits will be seen within the cavity of the cyst. So the fluid will become cheese-like with a viscous like thick fluid will be seen. Next question is, which of the following is not seen in the jaw bones? It is not seen in the jaw bones. So we have to read the question properly. That is, it is not seen and in jaw bones. So eruption cyst is not seen in the jaw bones, gingival cyst is not seen in the jaw bones, or nasolabial cyst, or all the above. So which among these is not seen in the jaw bones? The correct answer is all these cysts will not be seen in the jaw bones, because all these cysts are the soft cysts, that is eruption cyst. Before the any tooth erupts, it will be seen within the gingiva, within the alveolar mucosa of the arch, or the gingival cyst is seen in the gingiva, and the nasolabial cyst is seen in the mucolabial fold of the maxilla region in the center. So these are all not in the bone, they are soft tissue cysts. Next question. Epithelial lining of the dentigerous cyst is derived from which other tissues? So epithelial lining is derived from dental follicle, or gingiva of the erupting tooth itself, or rest of malassage, or any of the above. So what is the source for the epithelial lining of the dentigerous cyst? Answer is dental follicle. That is, dental follicular tissue will be present above the erupting tooth. From that follicle only this epithelial lining will form, and this cyst will form surrounding the erupting tooth. That is, it is attached to the erupting tooth at the cemento-enamel junction surrounding the crown of the tooth. So the epithelial lining is derived from that dental follicle of the erupting tooth only. Next question is eruption cyst. So regarding the eruption cyst, it is a false cyst, it is an odontogenic cyst, it is a soft tissue cyst, all are correct. So which is correct about the eruption cyst means it is a soft tissue cyst as we discussed. It is an odontogenic cyst, of course it is present within the ulnar arch only, and it occurs before the eruption of the tooth. So it is also a odontogenic type of odontogenic cyst, and it is a false cyst also. It is not having any epithelial lining. So the answer is all are correct. All these are correct regarding the eruption cyst. Next, a cyst in the jaws is usually painless, mostly presents as a swelling, is radiolucent, or all are correct. So which is correct about the cyst in the jaws? In general, any cyst will be like usually painless, presents as a swelling, or radiolucent, or all the above are correct. So the correct answer is all the above are true regarding the cyst in the jaws. Usually it will be painless, causes swelling. Most of the time patients will come to the dentist once they see a swelling. Otherwise usually it is painless. Only if it is secondarily infected, the patient will have some symptoms like pain and swelling. or like first discharge, then only the patient will come to the doctor. Otherwise the cyst is painless, and if it is seen radiographically, almost all the time it is radiolucent only. So any cyst will be radiolucent except for any calcifying types of cysts. So all the above are true regarding any cyst in the jaws. Next is the recurrence. What? So it is more common with which type of cyst or tumor? Following cysts. Buccal bifurcation cyst is most commonly will recur. Keratocystic odontogenic tumor, residual cyst, or all the above. All this will have the recurrence. So which will have the more recurrence? Comparatively, it is more common. Recurrence is more common with this cyst. So the correct answer is keratocystic odontogenic tumor or odontogenic keratocyst. This cyst has got more recurrence rate. Next question is, which of the following is non-odontogenic cyst? It is a cyst, but it's not because of the odontogenic tissues. The origin is not from the any odontogenic tissue. Which is not the odontogenic. It is not odontogenic cyst. Primordial cyst, periapical cyst, residual cyst, or the simple bone cyst, which is not odontogenic cyst. The correct answer is simple bone cyst. Okay, so this is not a odontogenic cyst. It will not appear in the jaw, like it's in the odontogen, like dental region, that is in the ulnar arch. It will not appear. It will appear, if it occurs also, it will appear below the inferior alveolar canal in the mandible. So the other name is traumatic bone cyst. Next question, ameloblastomas. Regarding the ameloblastomas, they show calcified material at the center of the tumor. Calcification starts from the center of the tumor, or calcifying occurs from the periphery of the tumor. It will start and extend to the center, or it is locally aggressive, or it is common in the maxillary molar region. Which statement is correct regarding the ameloblastomas? So the answer is locally aggressive. These ameloblastomas will not show any calcifications, and also this is most common in the mandibular molar regions. So the correct statement about the ameloblastomas is they are locally aggressive benign lesions, and most commonly they will cause the swelling, and all these are the true about ameloblastomas. Next question is, radiographically ameloblastoma appears as how it appears? Unilocular, multilocular, it may be unilocular or multilocular, or unicystic it appears. The correct answer is it may appear as unilocular or multilocular. It can be unicystic also. There is a variation of ameloblastoma that is referred to as unicystic ameloblastoma, but that here it is not a radiological manifestation. It is histologically you will describe it as unicystic, but in coming to the radiographically we have to describe it as unilocular or multilocular. So it will appear both, like unilocular also, multilocular also. Next question is, most common type of cyst in the jaws. Which is the most common type of the cyst? Is it follicular cyst, apical periodontal cyst, dentator cyst, or eruption cyst? Okay, just go through this. And which is common type? Most common type of the cyst in the jaws is apical periodontal cyst, otherwise or radicular cyst. It is also known as radicular cyst. Next, radiographically, odontogenic keratocyst is characterized by how it is characterized radiographically. It will have the scalloped outline, that is the margins are scalloped. It may be periocoronally located, may be sometimes pericoronally located above the crowns. It grows along the length of the jaws, or all the above true about the radiographical manifestation of the odontogenic keratocyst. So which is correct? Scalloped outline, it may be pericoronally present, it grows along the length of the jaws, or all the above. The correct answer is all these statements are true about the odontogenic keratocyst in the radiographs. They will have the scalloped margins, that is the margins will extend in between the roots of the teeth. So they will have the scalloped margins, and they may be present pericoronal, coronal to the erupting tooth, and they grow along the length of the jaws. That is because of this feature, the swelling, the clinical presentation of this cyst as swelling is rare, because before it appears causes any swelling of the jaws, it will extend anteroposteriorly along the jaws, along the bone. Next, radicular cyst. So which is true about the radicular cyst? Occurs with a non-vital tooth. it is a true cyst, it is the most common odontogenic cyst. We discussed it is the most common odontogenic cyst is true. So others also, will it occur with a non-vital tooth and is it a true cyst? So which is correct? The answer is all these statements are correct regarding the radicular cyst, because most of the time it is caused by the inflammation or infection in the pulp cavity. It is a most common odontogenic cyst because the caries is most common seen in the teeth, and it occurs with a non-vital tooth. It is a true cyst also. Next, benign cementoblastoma. So it is an epithelial odontogenic tumor. It is associated with vital tooth. It occurs in the elders, or all the above statements are true regarding the benign cementoblastoma. Only the statement it is associated with a vital tooth is correct, because other first statement is it is saying that it is an epithelial odontogenic tumor. No, this is a mixed like mesenchymal odontogenic tumor. It is derived from the mesenchyme, that is it will form the cementum. So the mesenchymal cells are involved. It is not epithelial. It occurs in the young adults and it is associated with vital tooth. So only the second statement is correct. Next, odontomas. These are odontogenic epithelial tumors, occur among young adults, are aggressive in behavior, or all the above are true. So which statement is correct regarding the odontomas? They occur among young adults is true, because odontogenic epithelial tumor is wrong, because odontomas are mixed tumors. They will have both the enamel and the dentin and everything, like almost like they will appear as a tooth structure. So they are mixed odontogenic tumors. They will have epithelial component and also the mesenchymal component, and they are not aggressive in behavior. So only the second statement, that is they occur among young adults, is the correct statement. Nevoid basal cell carcinoma syndrome is associated with which autosomal dominant trait, hypertelorism, enlarged calvarium, or all the above? Actually, it is associated with odontogenic keratocyst. Okay, multiple odontogenic keratocysts will be seen in this syndrome. Along with that, you will see all these features. So the correct answer is all the above. So it is autosomal dominant trait, hypertelorism is seen, and also enlarged calvarium is common. Next question is, differential diagnosis for residual cyst is. Residual cyst means after even the tooth is extracted, the radicular cyst will remain within the jaw bones, and that particular cyst which is not associated with any non-vital tooth, so that cyst is called as residual cyst. It is a form of radicular cyst only. So what is the differential diagnosis for this residual cyst? Eruption cyst, gingival cyst, or odontogenic keratocyst, or all the above? So which will be the differential diagnosis? Obviously odontogenic keratosis, because it is only the cyst which is occurring within the bone. Other two will be soft tissue cysts. So you cannot consider them as radicular cysts, residual cysts only. So okay, so that is odontogenic keratocyst is the differential diagnosis for residual cyst, if it is single, appearing as a single cyst. Next is follicular cyst refers to what? Dentigerous cyst, odontogenic keratocyst, nasolabial cyst, or radicular cyst. Which is the follicular cyst is the other name for what? It is dentigerous cyst, because we have learnt that in the dentigerous cyst the epithelial component is derived from the dental follicle. So it is also referred to as the follicular cyst. Next, differential diagnosis for nevoid basal cell carcinoma syndrome includes. So in this also we are seeing multiple odontogenic keratosis. So what is the differential diagnosis for this? Multiple myeloma, multiple dentigerous cysts, cherubism, or all the above? The answer is all the above. In all these lesions, multiple or myeloma also you will see multiple radiolucent lesions, multiple dentigerous cysts. As the name indicates, there are dentigerous cysts which are multiple in number, and also cherubism also you will see multiple, like multilocular radiolucences. So all this will come under the differential diagnosis for multiple odontogenic keratosis as seen in this syndrome. Next question. Adenomatoid odontogenic tumor. It is histologically shows distinct capsule surrounding the tumor. It will show distinct capsule, or recurrence is common with this, or common site is the mandibular molar region, or all the above are correct. So adenomatoid odontogenic tumor. So it is again a odontogenic tumor that is derived from the epithelial component. It is epithelial odontogenic tumor. Okay. So which statement is correct regarding this particular tumor? Histologically, it shows distinct capsules surrounding the tumor. The tumor will be surrounded by a capsule. That is well-defined tumor disease. But the recurrence is common is wrong, and also the common site is not the mandibular. It is maxillary anterior region is the most common site for this tumor. Which among the following is mixed odontogenic tumor? Mixed means both the mesenchymal and the epithelial component are present in this particular odontogenic tumor. Is it adenomatoid odontogenic tumor, Pinberg tumor, or odontogenic myxoma or ameloblastic fibroma? So which is mixed odontogenic tumor? They are asking about the mixed pattern. The answer is ameloblastic fibroma. Okay, in this we will see the fibroma is the mesenchymal component and the ameloblastic means ameloblastoma is the epithelial tumor. So epithelial and mesenchymal both are same, so it is a mixed odontogenic tumor. Whereas adenomatoid odontogenic tumor, it is only epithelial component is same, and in the Pinberg tumor also it is also an epithelial tumor. That is, it is calcifying epithelial odontogenic tumor. The other name is, and odontogenic myxoma is only mesenchymal component is seen in this. So ameloblastic fibroma is the mixed odontogenic tumor. Next, benign non-odontogenic tumors of jaws include all this. Now, till now we have discussed all the odontogenic tumors. There are many non-odontogenic tumors also occur in the jaws. So what are they? Is it desmoplastic fibroma or osteoid osteoma, osteomas, or all the above? So as the name indicates, all the other three are all non-odontogenic tumors. So the answer is all the above. Desmoplastic fibroma or osteoid osteoma and osteoma. These are the tumors, benign tumors that are presented in the jaws but they are not odontogenic. Thank you. Thanks for watching. Please keep subscribed and follow our channel to discuss more and more topics in oral medicine and radiology. Thank you.